Hello, I'm Jennifer Dexter, the Assistant Vice President for Policy at the National Health Council. Very happy to be with you to talk a little bit about the work that the National Health Council has done over the last several years to develop policy recommendations to advance health equity. But first, let me tell you a little bit about who the NHC is. We were created by and for patients over 100 years ago. We bring together diverse organizations to forge consensus and drive patient-centered health policy. We promote increased access to affordable, high-value, sustainable healthcare. And obviously, health equity is very much at the core of that. We're made up of more than 140 national organizations. Our core membership are the nation's leading patient organizations. Other members include health-related associations and nonprofit organizations, including the provider, research, and family caregiver communities, and businesses representing biopharmaceutical, device, diagnostic, generic drug, and payer organizations. In 2020, in the aftermath of the bright light that the COVID-19 emergency and the national dialogue around racial justice shone on health equity, we undertook a dialogue with our board of directors, members, and national thought leaders to identify those equity-related policy areas that were most significant to people with chronic diseases and disabilities. We partnered with an NHC member, the National Minority Equality Forum, and then pulled together thought leaders from both the health ecosystem as well as civil rights and other groups. The result of that initial dialogue was a consensus statement that was signed by 58 CEOs of national patient groups, committing to work together on 4 key priority areas. Those were advocating for equitable access to affordable and comprehensive health insurance coverage, promoting an inclusive, equitable, accessible, and high-quality care delivery system, partnering with organizations that have a track record in addressing social determinants of health to reduce health disparities, and collaborating with the biomedical and health services research and the health economics ecosystem to support equity in development and valuation of new and innovative treatments and services. In addition to working together on those 4 key areas, I also committed to some guiding principles, and I'm going to read them to you now because I think they're very important. The consensus statement states that our current health system came of age when racial segregation and many other forms of discrimination based on such things as gender identity and sexual orientation, disability, and other factors were sanctioned by custom and law. Widely practiced discrimination bred structured health disparities for racial groups and other population whom the society decided to disadvantage. The U.S. healthcare system has dismantled the outward manifestation of segregated care so that race is no longer the explicit discriminator. However, the legacy system continues to bolster discriminatory practices and has replaced the language of segregation with new discriminators. These discriminators, such as location, personal income, and employment and insurance status, disproportionately impact the historically disadvantaged. The net result is that structured health disparities remain. After releasing the consensus statement, in 2021, we once again gathered thought leaders in discussion for each of the 4 key priority areas, resulting in the 4 sets of policy recommendations included in a report we released in February titled Access, Affordability, and Quality, a patient-focused blueprint for real health equity. Each of the discussions identified some core principles as well as specific policy recommendations. One set of short-term recommendations that were those things that Congress was either considering or the administration was, or there was consensus within the community around what the solution should be. And a second set of more complex but critical issues. And those were areas where we either needed to build political will or we still had work to do to reach a consensus around what the solution is. Some examples of some of the recommendations, just to give you a feel for what's included in the report. Under access to coverage, a short-term recommendation is to expand Medicaid in states that have not done so, and or create a federal fallback for those in the Medicaid coverage gap, since we know that that lack of Medicaid coverage disproportionately affects marginalized populations. In access to care, we recommend increased access to telehealth to ensure more people can access health services, no matter where they're located, or their transportation options. For social determinants of health, one of the more complex issues identified was providing adequate funding at the federal, state, and local levels to support comprehensive, accessible social support systems that are available to anyone, regardless of their economic situation or location. Then finally, under medical innovation, a short-term recommendation is providing federal guidance and tools to help increase the diversity of clinical trials, including the use of decentralized trials where appropriate. This is an area where both the FDA and Congress have made progress over the last several months, thanks to advocacy by the NHC, our members, and other advocates. Each area of policy recommendations demand comprehensive attention from policymakers. We can no longer address issues of health equity in a piecemeal manner. It is time for a complete transformation of the healthcare system to promote unbiased structures and processes to advance equitable access to quality healthcare for all. The NHC, our members, and other partners will continue to work together to advance these policy priorities, and we're already seeing advancements as a result of that work. The other thing I wanted to share with you today are some of the key themes. Through this whole series of discussions, there were 4 areas that we identified that really were things that touched on all the areas. The first is the importance of accurate, comprehensive, consistent, and interoperable demographic data, making sure that the federal government, researchers, payers, providers, we're all collecting the same demographic information at the same level of specificity and sharing that and comparing it. The next was the need for clarity, usability, availability, and cultural and linguistic appropriateness of health information. Too often, there's such a focus on health literacy of the individual patient and not enough focus on how are we providing health information in ways that are usable and actionable for all people. The next was increasing the representation of marginalized communities in the healthcare workforce, including in care delivery, education, and research, making sure that the people providing care and educating and researching look like the people that are the end users of that work. And then finally, engaging a diverse and representative set of patients in all healthcare decisions. For many years, the NHC has led efforts to make sure that patients are engaged in all aspects of healthcare from the very beginning to the very end user, and making sure, taking that the next step and making sure that the populations that are engaged are representative of marginalized communities is a critical next step. As I mentioned, we are continuing to work to advance these policy priorities with our members and partners, and we will continue to work with our membership also to amplify and support all of the great efforts that are happening throughout the health ecosystem to advance health equity. I look forward to working with you as well. I encourage you to go to the National Health Council website, nationalhealthcouncil.org, in order to review the report and the recommendations and learn more about our health equity work. Thank you so much.